Thank you for joining me today. In this video, we are going to go over psychiatric medication that needs lab monitoring. There is a 10 psychiatric medication that you want to remember that needs a lab monitoring. The key is not to memorize every lab test for every medication. The key is to memorize the drug that needs to be checked and monitored, the organ that they affect, and the system that they affect, and the lab test, and the major toxicity relationship that this medication has. So number one medication that you want to memorize and remember is lithium. Lithium level has to be checked and monitored. You want to also check the creatine and EKG, the kidney function. You want to also assess the thyroid stimulating hormone, calcium level, and electrolytes. So for lithium, you want to check the lithium level, you want to check the kidney function, thyroid stimulating hormone, calcium level, and electrolytes. Why? Because lithium is excreted in the kidney, it affects the thyroid and parathyroids. So lithium function depending on the kidney function, thyroid function, calcium level, because it affected the calcium level, it affected the thyroid gland, and it regulated and excreted in the kidney. Next medication, and the second medication that we want to go over that you need to monitor the lab is Valproate. Valproate, you want to assess the liver function, complete blood count, platelet, drug level when indicated. So Valproate, liver function, complete blood count, platelet level, drug level, because it affected it has a liver toxicity and it causes thrombocytopenia. So it affected the liver and platelet, and you want to check the level of the Valproate. For the third medication that we want to memorize to check the lab, it is Carbamazepine. Carbamazepine, you want to assess the complete blood count, liver function, sodium level, drug level when indicated. It causes blood dyscrasias and liver toxicity and low sodium. So Carbamazepine affected the blood, and you want to check the complete blood count. It affected the white blood counts. You want to check the liver function and sodium level. The fourth medication that we want to memorize to check the lab is Olanzapine. Olanzapine lowers the neutrophilic, which is the white blood cell. You want to assess the absolute neutrophilic count and monitor the metabolic. It affects it causes neurotropenia, agronocytosis, and it has a metabolic side effects. So when you remember Olanzapine, you have to remember to check the absolute neutrophilic count. The Antipsychiatric medication, if the patient taken antipsychiatric medication, especially if it's taken second generation antipsychiatric medication, you want to assess the weight, you want to assess the BMI, blood pressure, diabetic, glucose level, A1C level, lipid panel. It causes metabolic syndrome. If the patient is taking tricycline antidepressant medication, you want to check the EKG when indicated. Tricycline antidepressant medication causes abnormal heart rhythm. It increases the QT prolongation. So tricycle antidepressant medication affect the heart. So you want to check the EKG. For serotonin norepinephrine reuptake inhibitor medication, you want to check the blood pressure and liver function depending on the age of the patient and the risk. It causes hypertension and it has a medication, specifically liver toxicity, such as Venlafaxine increases the blood pressure. So you want to assess the blood pressure. Lamotrigine, if clinically indicated, causes rash. So you want to assess the skin. And it causes Stevens-Johnson syndrome and has the dermal necrosis. So you want to assess the skin. Stimulating medications, you want to assess the blood pressure, heart rate, weight, and growth of the child and the appetite. You want to assess also cardiovascular and growth, because stimulants affect the growth, blood pressure, and heart rate. For the SSRIs medication, which is antidepressant medication, you want to monitor the serotonin syndrome. It increases the risk of the serotonic toxicity. You want to also assess the suicidal ideation. SSRI generally do not require routine drug level checks, but it has a higher risk of suicidal ideation and serotonin syndrome. So again, if the patient is on lithium, you have to assess the kidney function, thyroid function, calcium level, electrolyte level. You have to do the pregnancy test when indicated and appropriate. You want to also assess the medication interaction and review the medication that the patient is on. You want to assess the weight and metabolic BMI. Lithium has a narrow therapeutic index. Lithium, depending on the kidney function, thyroid, it causes hypothyroidism. Calcium level, it increases the calcium. You want to assess the lithium toxicity. You want to watch for coarse tremors, ataxia, dysarrhythmia, vomiting, diarrhea, confusion, severe neurological or cognition changes, seizure. Factors that increase the lithium concentration include dehydration, sodium depletion, thiazide diuretics, NSAID medications, angiotensin conferring enzyme inhibitor medication, herbs, Valproate, you want to monitor liver. You want to monitor the liver function. It causes liver toxicity. You want to do the complete blood count and assess the platelets. It causes thrombocytopenia. Valproate concentration. You want to assess the drug level and monitor. And if clinically indicated, you want to assess the pregnancy test. Valproate has a significant fetal risk and is generally avoided in a pregnancy when other alternative is available, particularly bipolar patient, because of it has a major teratogenic risk and neurodevelopmental concerns. Valproate has a toxicity. When you think about valproate toxicity, think about the liver function, platelet count, pancreas. Potential complication that valproate toxicity can cause is liver toxicity, thrombocytopenia, pancreatic inflammation, increased ammonia in the blood. So valproate toxicity, you want to assess the abdominal pain, vomiting, consistent inflammation of the pancreatic, alter mental status. You want to consider hyperammonemia. For Carbamazepine, you want to monitor the complete blood count. You want to watch for leukopenia, neutropenia, granulocytosis, aplastic anemia. So you want to assess the liver function because it can cause liver toxicity. You want to assess the sodium level. Carbamazepine can cause low sodium, can lead to low sodium. You want to assess the drug-to-drug interaction. It can monitor if the clinically indicated. Major interaction with carbamazepine is strong hepatic enzyme inducer medications. Therefore, it can lower the concentration of many other medications. When you think about carbamazepine, think about the complete blood count, liver function, sodium level, and drug-to-drug interaction. For Olanzapine, this is one of the most important medication to monitor. You have to monitor the absolute neutrophil count. Why? Because it can cause neutropenia, and it can cause granulocytosis. Olanzapine prescribing and monitoring requirement can change over time. Follow a current regulatory and institutional requirement. Also monitor the weight, monitor the blood sugar, liver panel, blood pressure, constipation and GI function, sign of a myocarditis, and it can lower the seizure threshold. Red flags for Clozapine include fever, sore throat. If the patient reported sore throat or fever, thinking about neutropenia and infection. Chest pain, fever, tachycardia, thinking about myocarditis. Severe constipation and abdominal distension, thinking about Clozapine associated gastritis or low hypomotility and constipation. This can become a life-threatening condition. So, Clozapine, you have to monitor a absolute neutrophilic count, metabolic, signs of myocarditis, and bowel function. If the patient taken antipsychiatric medications, you want to monitor the metabolic panel. This applies particularly to the second generation antipsychiatric medication. You want to monitor the weight, BMI. You want to look for rapid weight gain. You want to assess the blood pressure and look for hypertension. You want to assess the glucose. You want to check the fast glucose, A1C, look for diabetic or insulin resistant. You want to monitor the lipids. You want to monitor the total cholesterol, low density lipoprotein cholesterol, high density lipoprotein cholesterol, triglyceride. If the patient is taking antipsychiatric medication with high risk metabolic risks, the high yield will be, if the question is asking for that, if the high yield will be Olanzapine, Olanzapine, Seroquel. Those are the ones that mostly have the highest risk of metabolic risk. Relatively low metabolic risk include Ziprasidone, Abilify. You want to also monitor the Prolactin. Routine Prolactin testing is not necessarily required for every patient taking every psychiatric medication. Instead, test it when the symptoms suggest higher or increased prolactin. Symptoms include glycosuria, amenorrhea, sexual dysfunction, infertility. High-yield medication that can increase prolactin include Risperidone, Risperidone, antipsychiatric medication that increases the risk of QT prolongation include Ziprasidone, Haldol, thyroid. You want to monitor and do the EKG, patient cardiac history before you prescribe the medication. You want to conduct a baseline QT intervals, electrolyte abnormality. You want to assess if the patient is taking other medication that can increase the risk of QT prolongation. You want to adjust the dose and the route. Important electrolyte may attention to is the potassium and magnesium. If the patient is taking antipsychiatric medication, anti-depression medication, tricycline antidepressant medication, routinely you want to monitor the cardiac when indicated, especially older adults and the patient who have a cardiac disease. High doses can lead to cardiac risks and can lead to QT prolongation. Tricycline antidepressant medication can cause conduction abnormality, arrhythmia, QT prolongation. It can cause orthostatic blood pressure. So when the patient is taking tricycline, you want to assess the cardiac and do EKG for cardiac toxicity. If the patient is taking SSRIs medication, you want to monitor suicidal ideation and thoughts. You want to assess if the patient has any symptoms, and you want to educate the patient if the patient has any signs or symptoms for serotonin syndrome, sexual dysfunction, hyponatremia, blood risk, if the patient is having or developing mania or hypomania, because it can increase the mania if the patient is bipolar. For older adults, if the symptoms suggest low sodium, you want to check the sodium level. If the patient is taking serotonin norepinephrine reuptake inhibitor like the Venlafaxine medication, you want to check the blood pressure. Prolactin, you want to assess the liver balance, and it causes liver injury and liver toxicity. Bupropion or Valproate increases the seizure threshold. You want to assess the history of seizure before you prescribe this medication. You want to assess the eating disorder history, alcohol or benzodiazepine withdrawal risk, blood pressure. Bupropion or Valproate, you want to assess the seizure history, alcohol and benzodiazepine withdrawal, eating disorder, blood pressure. If the patient is taking Lamotrigine, you want to assess the skin rash, blisters, lesions, fever, skin pain. If the patient is taking stimulant, you want to monitor the blood pressure, heart rate, growth, weight, appetite, sleep for the children and teenagers. You want to assist the height and growth trajectory. You want to also assist the misusage and diversion, substance usage, and psychiatric symptoms, because stimulant can be misused and it leads to addiction. If the patient is taking atomotoxin, you want to check the blood pressure, heart rate, weight, and appetite, suicidal ideation for the children, and liver function. You want to assess the warning signs of liver toxicity, such as jaundice, dark urine, right upper quadrant pain, and explain severe weakness. If the patient is taking benzodiazepine, you want to assess and monitor the sedation, respiratory depression, fall risk, cognition changes, dependency and misusage, and withdrawal. Benzodiazepine can lead to withdrawal risks and dependency if benzodiazepine can interact with opioid, and that leads to respiratory depression and death. So you want to educate the patient and you want to assess that. Antidepressant medication can lower the sodium. Antidepressant medications such as selective serotonin reuptake inhibitor, it can lower the sodium level, so you want to assess the sodium level. High-risk patients include elderly, patient who is taking diuretics, patient who have a previous low sodium. You want to assess the symptoms of headache, nausea, confusion, weakness, and seizure if it's severe cases. Thank you for joining me today. I would love to see you in my next video. Please subscribe and join me again. Thank you.